Good luck with the presentations.
Welcome everyone. 안녕하십니까? And very good afternoon, good evening, and good morning to all. This is Jinwon Lee, National Professional Officer, work for Water and Living Environment in WHO ACE, ACE, as WHO Asia Pacific Center for Environmental Health in the Western Pacific region, located in Seoul in the Republic of Korea. We call ACE, ACE. It's our great pleasure to host the Water and Sanitation Technology Options for Healthcare Facility webinar today. Last October, at the Member State consultation in Manila, ACE and the University Technology Sydney introduced the Water and Sanitation Technology Project. And today, before the publication of this Water and Sanitation Technology Options for Healthcare Facilities, we have gathered here to talk and share insights, aiming to drive in the field of water supply and sanitation. Next week, March 22nd, is World Water Day. Last World Water Day at the UN 2023 Water Conference, UN Secretary General urged the global community to respect and protect and share water for the benefit of people and the planet. There was highlighted that the importance of recognizing water as a global common good, and also the needs for the capacity building and technology transfer and water innovation and knowledge sharing was emphasized. To address these points, WHO ACE and the University Technology Sydney have developed this project, and today speaker will share the water and sanitation technology project, and the panels will share their experience and the insights. Please use the chat box if you have any questions, queries, or any suggestions, or you can email it as well. In addition, this will be recorded for distribution as well. Okay, let's start. And I'd like to introduce today's moderator, the Professor Guy Howard. He is in the University of Bristol, and he is a water scientist and engineer. He has worked in the variety of roles related to water services and management in the West Pacific region and in the whole world as well. He has been a technical advisory group member on climate change and environmental health as well. Professor Guy Howard, the floor is yours.
Thank you, Jim-Won, and good morning, afternoon, evening to everybody on the call. So I think this is going to be a very interesting and hopefully very informative session, which I'm hoping that you will all find really helpful in thinking through what is quite a critical issue for countries in the Western Pacific, which is around how do you select the right types of water and sanitation technology for your healthcare facilities, bearing in mind your healthcare facilities vary hugely whether you're on a small Pacific island state or you're in one of the large continental Asian countries. So in a minute, I'm going to pass over to our speakers. We will have a presentation that I think will be led by Professor Juliet Willits from UTS. After the presentation, we'll have a small amount of time for questions and answers, which are focused actually on the presentation itself. And Dr. Benny Russo will be helping Professor Willits in answering those questions. If you have got questions when we get to that point, I'll remind you again Either can you raise your hand and turn your camera on, or can you at least make sure you have questions in the chat so that we can be tracking them. Once we've had the presentations and the Q&A, we will then have a panel session, which will last for around about 40 minutes or so, where we have three excellent panelists who can offer reflections both from within the region, but also more globally, on experiences about dealing with WASH in healthcare facilities. Right, I'm not going to say any more about myself or the organisation. I think that's very clear. What I'd like to do now is to hand over to Professor Juliet Willits from the University of Technology, Sydney, to present the findings of the study that herself and Dr. Russo undertook to look at WASH technologies in healthcare facilities. I will let Juliet introduce herself, but I suspect anybody in the region is probably already extremely familiar with Juliet and the work that she does, as well as the rest of her team at the Institute of Sustainable Futures. So Juliet, please, over to you.
Great. Thank you, Guy, and welcome everybody. It's a pleasure to be able to be here to share this work, which we believe is very, very important for the region, and also, as we know, is an issue globally beyond the Western Pacific region. So as Guy and Jinwon have mentioned, the focus of the work is about this selection process. There are many technologies out there, but how do we make sure that we're matching the right technologies with the right circumstance in healthcare facilities? And as has been mentioned, this work was undertaken together with Dr. Benny Russo, and he'll be here to be part of answering questions about the work. So first of all, why focus on this area of technology selection for healthcare facilities? Three really important reasons. The first is that we still have quite low coverage in many countries in the Western Pacific region, more generally in WASH, and also specifically to do with healthcare facilities. And in some areas, we have big gaps in data to even know what facilities we have. But we know, for instance, in Kiribati, we have less than 80% of healthcare facilities with basic water and sanitation. We know in Laos, in Solomons Islands, and in Fiji, we have as low as under 10% of healthcare facilities with proper sanitation and wastewater facilities. So it's a big issue that we need to solve. The second reason why technology selection is important is because of the very specific requirements that healthcare facilities have. They're not just a house or another institutional building. There are specific requirements, which I'll speak about next. And the third reason is that we actually don't have many resources. We were quite surprised when this work, when we started discussions with WHO, to discover that actually there weren't many resources. And the World Bank also found similarly a few years ago in their review, when they started to do more detailed work on WASH in different institutional settings, that we actually don't have many tools to help support this kind of decision-making process. So the process that we followed to try and address this gap began with a literature review, which I'll speak about in a little bit. We undertook a set of country consultations to understand decision-making processes as they happen at the moment and the existing technologies that are being used. We then co-developed a framework and guidance materials, which we took, as Jinwon mentioned, to a member states meeting, which was late last year. And here we are today. We're able to share this work much more widely, which we're very happy to have reached that point. And we're in the middle of a design and editing process, which means that the publications will be released shortly, and there will be some draft versions that we're able to share today for those who are enthusiastic and want to get onto it immediately. So first of all, I think important to just touch on the different requirements that healthcare facilities have for water and sanitation technologies. Firstly, for water supply, we can have quite high water consumption, higher than might be needed than in other types of buildings. We may have a real requirement for continuous supply, that we can't survive. We can't have, a day without water or even hours without water. and this may require backup storage systems. We may have certain water quality requirements that are more stringent. We're trying to look after patients who are sick, and the last thing we want to be doing is exposing them unnecessarily to hazardous compounds or to pathogens. We have a need to really watch out for the potential for internal contamination within the plumbing systems of healthcare facilities. And lastly, depending on the healthcare facility and whether we're talking about a big hospital or a much smaller facility, depending on the different services, we may need ultra pure or sterile water, and we need, again, technologies to help deliver that. On the side of wastewater, it's obviously the other end of the line, and here it's more about how do all the different compounds and things that happen within a healthcare facility, how do they end up in liquid waste? And the issue is that we actually end up with wastewater with quite diverse characteristics. There can be a whole range of different types of substances in that wastewater. It's not just a single toilet that's flushing, and it's also water that ends up in drains from all sorts of different processes in surgeries or elsewhere. So we can have pathogens, we can have emerging contaminants, we can have antimicrobial resistant bacteria, and we can have pharmaceuticals. And that creates quite a different waste to think about treating. And that means that we need treatment processes that can deal with a much wider range of hazardous compounds. We know that the starting point for sanitation, as I mentioned just before, for Lau, for Solomons, for many places, is that we barely even have basic sanitation systems. And so in thinking about improving wastewater, we realize that we may need to start with simplified technologies in some circumstances, but we must be aware in doing so that we may be reducing public health risks, but we really won't be eliminating them. And that is particularly for the case of hospitals where we're going to have a much wider range of contaminants. And lastly, in terms of wastewater technologies, yes, if we're in a city context, maybe we can combine with municipal wastewater. But equally, because of those different wastewater characteristics, there may be different forms of pretreatment that are required before we simply discharge to sewer, or we might actually need some more advanced on-site treatment for particular streams or even for the whole wastewater stream. So coming back to our process, and this is to share with you some of the resources which are available, is that we undertook a literature review at the outset, which looked at both the existing technologies that are being used in different types of healthcare facilities, and there are as well as emerging technologies and their applicability in healthcare settings. And so that was mostly academic literature to make sure that the kinds of technologies we're putting forward are indeed matched to these very specific needs that I just described. We also undertook country consultations, and these were in Mongolia, in Vanuatu and Laos, so very, very different context you can imagine, from freezing pipes being an issue to floods and cyclones. So very different context. And we spent time talking to government and to WHO staff to understand which technologies are they using and how did those technologies get chosen? What kind of process was used? Was it based on cost? Was it based on familiarity with the technology? Was it based on what the private sector could offer? How were current decisions made? And we used that information to help us then build up a framework for decision making. And so the third output is the main piece of work, and that's guidance to inform decision making. And it's focused around three main groups of factors that we discovered through that process of engaging with the countries are all really, really important for informing decisions. And those are institutional factors, technological factors, and then the actual site and the environment in which it sits. And so I'm just going to share briefly the types of criteria or factors that are part of this guidance. So on the part of the site and environmental factors, we've got nested systems here. We have a healthcare facility with its specific different water supply requirements and wastewater needs. it sits within a broader human environment. And maybe, as Guy mentioned, maybe that's a small rural village, or maybe it's a big city where there is actually some external infrastructure. And so whether or not there is piped water, whether or not there's a wastewater treatment plant, is obviously very impactful in terms of what technology the healthcare facility itself needs, and whether it needs to be independent or linked up to those wider services. And then that human environment sits within the very important natural environment when we're talking about water and sanitation, because that's about what water resources are available in that context, the climate in that context, what kind of characteristics they have. Is there good quality water? Is there only poor quality water available? And also we're disposing into that environment. So we need to understand the characteristics of the site. We need to understand topography and soil and ensure that we're not having a negative impact on that broader environment. So those are the site and environmental factors. And then the set of institutional factors are mostly around the public sector. Healthcare facilities are public institutions. It's really in the hands of the public sector to both install and to manage and maintain water and sanitation technologies. So their investment capacity, their expertise, their human resources are all very important aspects. And as are standards and guidelines, which vary from country to country. In some places they don't exist, but in others they do, and they need to be taken into account. And beyond the public sector, of course, many technologies, and especially as we think of more advanced technologies, the private sector comes into the picture. They're the suppliers of these technologies. They may be the ones who operate them or maintain them. And in some countries, there's lots of possibilities in terms of suppliers. In other countries, very, very few. And if we imagine some Pacific islands, you may have almost no private sector capacity. So again, another important factor to consider in decision making. And lastly is the interlinkage with climate change. In this age of being faced with climate change, an important aspect is understanding disaster response, climate change preparedness planning, and the impacts that that might have on choice of technology. So lastly, the third set of factors are to do with the technology itself. And that might be things about its construction requirements, what kind of needs it will have in terms of operation and maintenance. It's always an under-prioritized area. People are often just looking at the capital costs of a technology, but really what are the costs in the long term? What are the skill requirements? What are the spare parts that will be needed? The technology climate resilience will be important. Its treatment performance, is it going to be able to retreat to the quality requirements that we need in the healthcare facility? And lastly, the socio-cultural aspects of whether technologies will be accepted, whether some are going to be more inclusive or not in how they could be implemented. So this is the whole framework with its three parts. And at the center, we have the decision about the most suitable technology for a given healthcare facility. And that framework is in the guidance, is kind of systematized into tables where we provide prompt questions for each of these different areas. So I'll just show you how we imagine this being used. So we imagine that the guidance would be used by a combination of health sector staff and also people with water and sanitation expertise. So even though we've included lots of technical information into this guidance, we don't think it's necessarily usable by a health sector professional who has no background in water and sanitation. We think those different expertises will both need to be brought together to consider this framework of factors and prompt questions and bring that together with the range of different technologies where we've developed fact sheets to help provide simple information about key technologies, and together consider which ones will be most suitable for a given healthcare facility. So the types of prompt questions that are in the framework, I just have a couple of illustrative examples. So if we think of the site and environmental factors, the central one was the red one, which refers to the healthcare facility itself. What kind of size does it have? What number of patients? Does that vary over time? Are there peaks? What type of services are provided? And based on those services, are there particular needs about uninterrupted water or about particular qualities? What type and range of toilet facilities will be needed, and taking into account not just patients, but also outpatients, also staff? What kind of inclusion aspects might need to be given thought? And if we take, say, the sub area, which is about healthcare water requirements, we need to know something about both the quality and the volume of the different types of water end users, and so on. So you can see here on the left that there are also prompt questions about wastewater. There are prompt questions about plumbing design, about liquid waste management more broadly. And on this institutional side, again, just a few examples of the types of prompt questions. There are prompt questions about the guidelines that might be available, prompt questions about the capacity to operate and maintain or to set up contracts with the private sector amongst the public sector officials that might be responsible. And what kind of budgets are available, and what line items can be used both for construction but also very importantly for the operation and maintenance, and are we able to allocate budget to both those types of expenses? So on the part of the technologies, in the guidance, we've provided summary tables of the range of different technologies. And here we try to give just a quick go-to that can help you understand whether it's for to do with water or sanitation, but then what the technology steps are that it relates to, what type of cost it might be. Is it high magnitude or low, middle? What type of scale would you use it? Is it suitable just for a very small facility, or could you use it at much larger scale? What kinds of operation and maintenance requirements does it have, and are they high or low? And just some very key considerations for each specific technology. And then to support that are much more detailed technology fact sheets. And these cover a range of different technologies. For water supply, it includes, say, for groundwater, the different ways that you might treat groundwater. What are the chemical processes? What are the disinfection processes you might use? For surface water, again, how might you treat it? Might you use some kind of granular filter, or might you use some kind of membrane-based system? And then equally, we've included technologies around point of use, and those include technologies to do with needing to sterilize water for particular services, and also to provide high purity water that might need, reverse osmosis or deionization, particular technologies to get to that high purity that might be needed. On the side of sanitation, the technologies we include are from kind of, as I mentioned earlier, quite simplified technologies such as anaerobic baffled reactors that are really only a primary treatment step that removes more physical aspects and some organic matter, and then up to technologies that are much more advanced that include secondary and tertiary wastewater treatment to make sure that we're actually reducing the organic load much further, that we're dealing with biological contaminants, and that potentially we're also removing those various different hazardous substances. And that might need quite advanced physico-chemical processes. So zeolite absorption, there's a range of different types of chemical methods that can be used, and equally advanced oxidation processes, which might be needed for some compounds that are very difficult otherwise to remove. So the technology sheets are on quite a wide range of both simple and advanced technologies, and they provide information about performance, operation and maintenance, what type of energy requirements they might have. So one aspect that we added to the guidance to make sure that it went just a little bit beyond the decision-making process is to help people think through what some of the management practices are that they could use and it might help them reduce their costs and conserve water resources. Because if you take just as given that you're going to need certain amounts of water and you don't look at how you might internally do some recycling or look at different uses, there may be possibility to reduce costs and resources. And so some of those strategies are around wastewater source control. If we've got wastewater of quite different quality from different processes within a healthcare facility, it may be cheaper and better to keep for instance, a highly contaminated stream, keep it separate. And then you only have a very small volume to treat, as compared to throwing it in mixing it up with everything else. And then you have a much more complex wastewater to deal with at large volume. Another management practice is about the maintenance and operation of water plumbing systems and making sure there are management practices to deal with that, and also to deal with leaks. A very simple thing, but something that can cause a lot of wastage of water resources, with leaking taps, leaking pipes, etc. And lastly, safe water reuse, that in some circumstances, obviously it would need to be done very carefully, given the types of environments we're talking about for healthcare facilities. But there may be some non-potable applications where it's possible to use water of slightly reduced quality, or not go through some of the treatment steps that would otherwise be needed for high quality water. So I'd just like to briefly touch on the climate resilience of the technologies, because that, as I mentioned, is another key area for consideration. And when we think of the Western Pacific region, we know that that's particularly true, and that there are so many places that suffer from droughts, from floods and other hazards, and that water and sanitation technologies themselves are very, very susceptible to damage, and to need for flexible operation, different ways of using technologies in these climate hazards. And so we've embedded it in the guidance. There are prompt questions which specifically pull out climate concerns. And then we've also written a section at the end which describes some different design features that might be important to build in. That might be about, for instance, building a structure around a more sensitive technology to make sure it's protected from different climate hazards, or other different design features. So I've come to the end of the presentation. So this last slide is just about how we hope it will be applied and some of the ingredients we think will be important for that. Firstly is commitment. We know that it's going to need much higher budgets and increased expertise if we're really to provide proper water and sanitation technologies that last and sustain in healthcare facilities. And so that's going to need a higher level of commitment. It's going to need expertise, and even to manage this kind of decision-making process about appropriate technologies, we're going to need that mix of the health sector understanding of the services that they need to provide and the healthcare facility environment, combined with the water and sanitation technical expertise. And lastly, we hope if this guidance is used, that we could really see some big changes in the services that are available to populations in healthcare facilities in many of the countries in the West Pacific region. And lastly, on the bottom left here, we have links to the draft versions of the 3 documents, so the guidance, as well as the literature review, and lastly, the current status and context, which looks at what some of the current decision-making processes and existing technologies are. So with that, I will close off and say thank you. Thank you to WHO for the chance to work on this together. It's been a great process for both Benny and I, and we really do hope it's useful and it can create some change in this really important area.
Thank you very much indeed, Juliet. That was really helpful, and I think a really good overview of what's been an excellent piece of work. So we do have some time now for about 10-15 minutes for questions if people wish to ask them, either to Juliet or to Benny. You can either put your questions in the chat or please kind of raise your hand and turn your video on. If you are going to ask questions directly, can you please make sure you just say who you are, by which I mean just your name and your institution, we don't need any more. I don't see any current questions already, but I would encourage you to ask them if you can. While we're waiting, Juliet, I'm going to couple of things that I think is really useful for perhaps for you to also say, which is that it'd be quite interesting to know, what do you think is almost out of scope for something like this guidance? The reason why I'm reflecting is it's actually a discussion I had the other day with somebody in Glasgow that who deals with nuclear medicine. And so you have very, very specific problems with your waste streams because you've got radioactive materials, and actually prompting them to really think, well, actually, maybe we need our own dedicated wastewater treatment facility. But I mean, that's a very specialist thing. So, would a reader of this book expect to find that really, specialist knowledge, or actually would you just be signposting people on to say, well, actually, if you need to look at this, you need to go and talk to these kind of people?
Sure. Maybe I'll give a brief answer and then pass to Benny. I think we've looked to include kind of the main game. So, for instance, we don't deal in detail with radioactive waste, and I think given the starting point of where we're at in healthcare facilities, I think if we can at least make an incremental improvement in the types of wastewater treatment that we're using and have a better understanding of those liquid waste flows, that would already be good. So I think we've avoided trying to overwhelm people with the extent of technologies. But yeah, I might hand to Benny. I'm sure he's got some good reflections to share.
Yeah, that's correct, Juliet. And just thanks for the excellent presentation. You covered very well the work that we've done. And the idea of the guidance, as the name itself says, is to really guide. Is not an extensive document that will cover every single technology and how to design, how to operate, but the main value of it is to cover all those factors associated with it. And regarding the different streams, as you asked, Guy, regarding radioactive nucleides, there are some references that people who are interested, they can follow up, but we do not provide an extensive list of things to do and technologies and how to operate and design, just because otherwise the document will be overwhelming, as Judith said.
Yeah, no, that's really helpful, because I mean the reason why I ask it is that actually it is more about people being overwhelmed with this compendium of absolutely massive things, that all the things you could ever think about never do around wastewater. So I actually think having something that you've done, which is a guide, which is pointing people around decision making, I think is really, really helpful. We do now have a couple of questions in the chat. So I think the first one was from Tan. Is there any consideration on the availability in the market for the kinds of technologies and services that you have identified? So I don't know if you want to comment on that.
Also, yeah, I mean, along the lines of Benny's answer, it's that it's included as a factor in the framework, because countries will really vary in terms of the breadth of technologies that are available on the market and their different qualities, etc. And so it's definitely a key consideration if you're making a decision, and particularly as we know, there's lots of issues in the wash sector where very advanced technologies have been applied in contexts where there isn't a private sector who can then support and look after it. So the private sector capacity and market is very important. What we don't go into in the guidance is that we don't start analysing actual numbers of companies or brands of different particular technologies. We present very in generic form. Here's a granular filter. It could be a sand filter. It could be many other types. It could be many different companies who produce it, and we don't get into that kind of market assessment. But obviously that would be a next step. If you're actually then going to pursue particular technologies, you would need to get a much better understanding of the market in a given country and what competition there is or isn't, and where you would find good quality technologies. So again, I don't know if you want to add anything to that, Benny.
Yeah, I think you nailed the head of the Specifically, I think the idea of the guidance is not really to provide answers. We provide a base for you to have a critical thinking and what factors should we consider. Maybe not all of the factors will be relevant in your case, but some might do. And most of the time, some of those can be overlooked. So the market is an example. In some circumstances, it will be key. It's better to have a system that is not the most advanced one, but it can be sustained in the long run because you do have a strong private sector providing services and parts for your system to be operated throughout the time.
Just as a quick follow-up to that. So, I mean, I think it's, as you've made the point that this is a guidance, it's not a definitive compendium, and I think that's entirely appropriate. But in that guidance, are you also emphasizing the fact that when people are looking at the local private sector market, understanding, the strength of supply chains and responsiveness of local providers? So they might be sourcing technologies from a global market, and they might be a local supplier, but then it becomes crucial. Does that local supplier actually have the wherewithal to maintain the product? Do you talk about that at all in your guidance?
Yeah, there are specific prompt questions saying, think about that, exactly those things.
Yeah.
And this is also covered on the climate resilience section. How fast can you respond to a failure? And I think this has a lot to do with the local availability of parts and skills as well to repair any of the systems. So yes, definitely covered is one of the key points. Among many others, there's lots of things to cover.
But it's great. I mean, the reason I mention it is that actually it is very important, but it's surprising how often people overlook that as possibly the weakest point within their system. So it's brilliant that you're covering that. I also see that Sam Treglown from UNICEF also had a question for you both, which is, what were the things that surprised you most during your work? So what stuff did you not anticipate finding? And then as a follow-up, did you also think about hygiene, healthcare waste management, environmental cleaning as part of this guidance work?
Sure, I can take a first stab. What was surprising? I think, for me, it was probably conversations with Vanuatu about their situation. And it was hearing about, I guess, the realities of just how challenging it is to even manage to have a budget line that can be used for operation and maintenance, how the bigger investments are mostly come from donors who we're going to hear from in the panel. So it will be interesting to hear, but how challenging it is as the public sector to have technologies which are put in, but then you're responsible for, and if they are complicated, or in that case there was I guess our outsourced private operation of that technology, but then that wasn't going so well. There's a whole lot of different complications which can happen, and so to me it's almost the political economy around the decision-making process is a really important part, and it's not one we deal with in the guidance. The guidance is quite kind of technocentric, but actually I think in our conversations the politics and the realities on the ground definitely came to the fore, and those will be the reality, I think, of when anyone tries to use this guidance, is there'll be this whole other contextual factors that will be part of the process. And maybe just to cover the second part, which was about hygiene, environmental cleaning. So the answer is that we drew the boundary very firmly around water supply and around wastewater. And so it's not to say that we don't think the other things are important. It was more that there is a bit more existing guidance in other areas, and that this was really the gap. But I think in an ideal world, other resources need to bring it all together, because you actually wouldn't want to just solve, for instance, the liquid wastewater part without also dealing with these other aspects.
Yeah.
Sorry, Penny, I don't know if you want to share surprises for you.
Yeah.
Yeah, I think the main surprise for me was something that you touched on the presentation, Juliet, and it was the lack of available resources on that. I was surprised when we started looking into the literature and seeing case examples, not only in the Western Pacific region, but throughout the world on how can you make this decision? Is there any particular framework or something that we can base on? And it was really surprising for me to see the lack of studies on that. For me, this was the main surprise when we started the project. Okay, we'll have something to build on, and maybe we have to contextualize for this particular location. But it was something that we didn't build from scratch, but we had to kind of be the pioneers on that.
I think that final point is very interesting, and I might ask a little bit from the panelists when we get to it, because I think that there's more generally there's a surprising shortfall of guidance more broadly around institutional provision of services, which I think my big bugbear has always been markets, because no one talks about markets at all. But it's the same with healthcare facilities. It's very interesting that we haven't, as a community, got our act together with more guidance around this in something you would think is a little bit of a no-brainer that it should be there. And I think very good point you made there, Juliet, about the availability of other resources around healthcare waste management, for instance. And it is important as well as us being comprehensive that we don't end up by endlessly duplicating, because that can then be as confusing as no guidance. We've got one last question, which I'm going to ask you both before I'll let you sit back and listen to the rest of it. Coming from Johanna, basically asking, did you see any examples of operation and maintenance that were being done in an inclusive way with a wider range of stakeholders, so older people, women, youth, etc.?
I'd say, yeah, our conversations with the different countries around operation and maintenance were, more about healthcare staff and them balancing all the different demands of their work. And so if they needed to be responsible for going in, for instance, even physically going and getting water supply, then that takes them away from other duties. And so it was much less, I guess, around inclusion and the community involvement in operation and maintenance, but more about the workplace and balancing roles and workload, because these technologies, require people to have time to engage with them, either to use them or to be looking after them.
Great, thank you, Juliet. So I'm going to suggest we bring a close to this part of the session now. As ever, I have lots of really interesting, well, I think they're interesting, very specific things I would have loved to explore with you around, internal plumbing management and how you control risk from Legionella and cyanobacterial toxins. But I won't bore everybody else with my own pet values, because you two have heard them before anyway, so you don't need to hear them again. So a virtual round of applause for Juliet and Benny. Thank you very much indeed. I think really, really clear presentation, really good, clear answers, and I really would encourage people to read the guidance. It is absolutely excellent. So thank you very much, both of you.
Great. Thank you.
Thank you.
Great, thanks. So what I'd like to do now is to move to our second part of the session, where we're going to have a panel discussion. And I'm really pleased that we have three very good panelists today. So we have Sam Treglown from UNICEF, we have Ruth Kennedy Walker from the World Bank, and we have Jitendra Singh from the ADB. And actually, just before I start the panel, I'm going to ask each one of you just to introduce yourself briefly. What I'd ask you just to do is just talk, say what your role is currently, and maybe just one or two sentences around your background of other work that you might do that might be particularly important and relevant. And just as a heads up, Ruth, the political economy point that Juliet just made just then is, I will be coming back to you on that one. So you might want to think ahead on that one. So Sam, can I ask you to go first, please, just to introduce yourself?
Thank you very much, Guy, and thank you to WHO for the invitation to join this webinar. So yeah, my name is Samuel Treglown. I'm currently working with UNICEF's East Asia and Pacific Regional Office here in Bangkok, and the WASH Climate and Sustainable Environment team, which works on WASH in healthcare facilities in coordination with our health team in UNICEF Regional Office. Prior to being with UNICEF here in Bangkok, I've worked in different country offices, two in this region for UNICEF, Cambodia and Philippines. And in both of those countries, I worked on WASH in healthcare facilities. Looking forward to the panel discussion. Thank you. Okay.
Thanks very much, Sam. Ruth, can I ask you to go next, please?
Yeah, hi everybody. Nice to see you all. My name is Ruth Kennedy Walker. I'm a senior water supply and sanitation specialist with the Water Global Practice of the World Bank, and I'm based in Dar es Salaam, Tanzania. And within my role at the bank, currently I'm managing projects in Tanzania, so mainly on water supply and sanitation, but also around washing institutions, and also managing projects in Zambia, our Zambia country office. And at the global level, I also work very closely with my colleague Claire Chase on a global initiative around washing institutions. So really happy to be here on the panel today. Thanks.
Great, thanks, Ruth. And I was relieved to hear that you're based in Dar es Salaam. I had, for one horrible moment, I thought you were up in the middle of the night in Washington, and thinking that was above and beyond anybody's expectations. But that's great. Jitendra, can I ask you just to introduce yourself as well, please?
Thank you, Professor Guy. Hello, everyone. It's nice to be here. I'm Jitendra Kumar Singh. I'm a water supply and sanitation specialist in strategy and partnerships team of Water and Urban Development Sector Office in Asian Development Bank. And I'm based in Philippines. And in this team, strategy and partnerships, we reach out to financial partners. We work with our project team leaders working in different countries of Asia and the Pacific. And we also take care of knowledge management. And as I was just, we were going through the presentation of Juliet, we have been working with other countries in Laos, PDR, Vanuatu, and Mongolia. So nice to be here. Thank you.
Great, thank you very much. So I think, as everybody's seen, we've got a very good and diverse panel with people with different experiences. So we have a set of questions that I'm going to ask you to respond. And so the way I'll do this is that I will ask one person to lead the response. Once I have that, then I will come to the other two panelists to reflect, to add any other reflections. And I particularly encourage you to pick up on any issues that the first speaker might have said that you would like to expand on or offer an alternative view if you think that that's what you'd like to do. So, and what I'd also say is what I think will be useful is, obviously, as far as we can, it's great if we can provide answers that sort of have a regional context. But it's actually also important, I think, that people hear experiences from elsewhere in the world, because I think actually cross-learning is actually really important. And sometimes it's useful to hear what people do in different parts of the world that we perhaps haven't thought about doing in the Western Pacific, but actually would be very relevant. So with no further ado, I'm going to start. And actually, Sam, I'm going to start with you on the first question, which is really, you obviously have worked in this area quite a long time with UNICEF, both in the regional office, but also country offices. So from your perspective in UNICEF, quite a technical agency, works quite close on the ground with partners. So what challenges and opportunities have you encountered during your time working on this in implementing or scaling up best practices or trying to bring in new innovations in water and sanitation within healthcare facilities?
Thank you, Guy. Guy, maybe I can start by talking a little bit sort of global, broad picture, and then come down to some specific examples. So, I mean, first of all, I think as Juliet highlighted in the presentation, and we'll all know, this is an area of big and outstanding need. I think the coverage data that we have tells us that. And when we go to the field, we see that. What's really great, maybe just coming in a bit from the UN side, is that increasingly there's a acknowledgement, I think, of the need for work in this area. There was the UN General Secretary's 2018 call for action on wash and healthcare facilities, and then thinking about our WHO colleagues' World Health Assembly back in 2019, where there was this commitment from member states for universal wash in healthcare facilities by 2030, which gives us a target, which I think is important to acknowledge. This was a little bit unclear from some of the initial SDG framing, wash in healthcare facilities. Coming down to scale up and some of the dynamics around that, as part of kind of thinking for this webinar, I went to SDG 6, which is WASH SDG, acceleration framework, which was developed by different UN partners. And different areas mentioned there, which I think are quite helpful to think about. Financing. It was really interesting to hear from Juliet and other UTS colleagues that was something that struck them, the financing gaps, and great to have ADB and World Bank colleagues, part of the webinar as well. The other acceleration area for SDG 6, need for scale up, data. Juliet highlighted some of the data, what the data tells us, but also the data gaps. And just to give a perspective on this region, because of course WHO and UNICEF work on as the sort of data holders under the JMP for this area. Under half, latest wash and healthcare facilities reporting, under half of the countries in this region didn't have data. It's a big data gap. Then capacity development and innovation, other acceleration areas, which is where I think this framework and this guidance really sort of come in and will help. And governance is the last one, which I think we're going to sort of come to in maybe in later questions. Then some more specific thoughts and experiences and reflections. I really appreciated the what Juliet was calling the nested systems. The reflection I had on that, based on my experience and talking with other colleagues, is that I think it's really great to capture those different dynamics, but probably the technical system is a subset, is driven by the institutional and the environmental and site-specific systems. So I think it's really important that when we think about the technological side, that we consider those other areas, as the guidance is encouraging us to do. But I think it's really important for us to reflect on the primacy of those things, especially if we're saying that the financing is part of the institutional, the markets are part of the institutional. And I think that came out a little bit from the feedback from UTS colleagues as well. In relation to that, and to share specific experience and to sort of connect to some of these different elements, one of the things which UNICEF and WHO have been working on is a WashFit. That's the Wash Facility Improvement Tool methodology. It's launched in, I think, back 2018, now in its second iteration. Just to give a bit of regional experience on that. In this region, from WHO and UNICEF data, it's currently about a third of countries in UNICEF region, which is slightly different from WHO, but overlaps in many countries. I think one of the interesting things about that tool, and there are many different approaches, but one of the interesting things about the WashFit tool, which was referenced is referenced in the UTS guidance, is it really encourages this bottom-up facility-led planning. So it really sort of builds in these institutional systems and environmental systems. But one of the things that we're seeing in terms of challenges with scale up of that tool are since 2018, 30% of countries and in those countries, we don't yet have an example of full national, the countries that have adopted full national application of that tool, or of that methodology being, the use of it being funded from national budgets. So I think the institutionalization of some of this and the ownership by national authorities is a big challenge. it's also, and I'll wrap up very soon, Guy, it's also a great opportunity because health systems, health ministries, often some of the strongest ministries in the countries with national, subnational, local presence. And from the UNICEF side and from all of our sides, they're interfacing with people and with kids. So it's a great opportunity, which is part of what makes this work so important. Thanks, Guy.
That's great. Thanks very much, Sam. That's really helpful. Just before we move on to the next question, just wanted to ask first of all Jitendra and then Ruth if they want to add on that. And perhaps Jitendra, particularly, could you pick up this issue about financing? I think as Sam has identified, that's a big area, and obviously ADB is the big one of the big regional development banks, no longer the only one. But how do you see the financing landscape, and how can we advance more on that?
I consider this problem as a financing per se is not that big challenge as far as establishment of any solution is concerned in terms of water and sanitation related. So often it has been found that you establish a system, you bring the technology, and you provide the solution. But what doesn't work is long-term sustainability, like financing for operation and maintenance. Again, in operation and maintenance, the problem is not only finance, then know-how and availability of working professionals locally. And there are so many arenas in that. But if you ask me from financial perspective, there is a limitation when the lending organizations like MDBs can play a role. After 4 or 5 years of certain agreement period, they come out. So the challenging part for us becomes how to create an environment where through public participation or through any other innovative financing mechanism, the systems which have been placed can sustain. Yeah.
Right, thanks, Jitendra. That's really, I mean, that's a really important, really useful insight that actually it is, it's really the capital that is the problem, it's long term. And just picking up on that, maybe Ruth, you could respond to this, which is that I think very often when we look in these sectors, health think, well, it's a wash issue, so the wash sector has to pay for it. Whereas actually what we should be seeing is, if we are to fund operation and maintenance, this needs to be locked back into health budgets. And I'm just interested your experience, how, does that work? Do we have examples about how that transfer of ownership and responsibility is done effectively, or are we still trying to find our way?
If I understand your question well, my thinking on that is that it's not only municipal office and health department, but again, a working level means even at lending level in our office also. I consider that we are sitting in water and urban development sector office, and there is a health sector office. We need to talk more. When we are creating projects, we are discussing the scope with the government. From government side also, the integrated approach should be there in scoping and then finding the solutions, allocating budget.
Right.
And here one more catch is there. We often ignore is that it's a cycle kind of thing. So more and more requirement of financing in the healthcare facilities is because we are not financing properly towards water and sanitation issues, prevention of pollution to the water bodies and all this. So both the sectors should understand importance of each other. If we invest properly in water and sanitation, diseases will be less, requirement of healthcare will be less. So it's our choice where we are investing and where we choose not to, or less investment. Thanks.
Great, thanks, Jitendra. And Ruth, I mean, from the World Bank perspective and that sort of intersectoral relationship, what's your experience been, more globally about how do we try and work on that that collaboration and getting the health sector to take this on as its issue?
Yeah, thanks. So I think similar response to Jitendra that, in the bank specifically, we have like the health global practice who are working predominantly with Ministry of Health. We have with the water team that are predominantly working Ministry of Water. And often you find that the health team really needs to be better supported and may not have, not always, but in a lot of cases we see they may not have the expertise to be able to properly design and implement and support the government around the areas of WASH and institutions. So I think we are with Claire, I said that Claire and I started about 3 years ago this initiative on washing institutions, and that is really the key impetus to try and like break down these silos internally within the bank so we can better, obviously it's not, but look inward so that then we can better support our clients, so that we can bring the best team around the table, that we can try and break those silos between ministries of health, between ministries of water as our, primary clients, so that they're talking to each other, that they share information, that they have a good understanding. And also around, it's also key with timing, right? There's things like, thinking of cost effectiveness, so really value for money so that they can do more with the funds that they have. Again, creating data so that they can see the issues, right? Sometimes we think it's obvious, but actually, looking at the economic costs, how much they're wasting by not putting in a small budget line to operate and maintain. They're building, neglect, build, and actually making that financial case to ministers of finance sometimes really makes alarm bells, and they say, hold on a second, if that the case, if we put a small budget, it sounds obvious, but sometimes just pitching that through the health teams, through the water teams, but also to Ministry of Finance. And then I think the other thing I want to say, it's also about the timing, right? Often, these budget cycles, it's like once a year they're putting together the budget and then they're kind of trapped, so really making sure that the information that they need to make those proper decisions are within the budget cycles that they are going through as well. I think that's another important point. But let me stop there. Thanks, Guy.
No, that's great. Thank you very much. And having in one of my roles being a deputy head of department in the Human Development Policy Division department in FCDO, I appreciate the difficulties about trying to engage between WASH and health systems communities, because it's not straightforward. But let's move on. And Ruth, I wanted to pick up again with you around the second question, which is, I think it probably builds on some of the discussion we've just been having about, what are the factors that policymakers and decision makers need to take into account about investment and technology transfer decisions around WASH services and healthcare facilities. And I think what would be really interesting is if you could pick up a bit what you've just been talking about. How do you make the case? Who are the different people? And perhaps reflect a little bit on something that Juliet talked about, which is, the political economy of this is often the most important bit. And I know that's something the World Bank spends a lot of time working on. So yeah, I'm just interested in your thoughts around that, and then I'll ask the other panelists to chip in afterwards.
Okay, great. Thanks, Guy. So I just wanted to maybe start more generally of some of my views, and then I'll go to your specific and bring in some examples. So I think a lot of what I'm going to mention, I think Juliet very nicely crafted in a presentation, and it's obviously a fundamental part of the toolkit. So I think for me, some of the key factors. So first, kind of the local needs and context. So I think we drew on this, in terms of understanding the specific needs of the healthcare facilities and having the data with which often we find in our countries that that's just not there. And then to be able to make the business case as to what the needs are in terms of financing, in terms of the technical needs, in terms of the long-term needs, it's much more difficult. And I think those need to be crafted both, the needs now in this state, but also in the future, right? Thinking about changes that may appear, whether it be climatic risks, whether it be, population growth, some of these factors which may again affect the requirements in terms of WASH and healthcare facilities. So I think they're important. I think this sustainability, really thinking the factor around sustainability. So how are we going to finance this and keep these facilities in the long term? And I think in terms of, because we're talking about technology, the scalability and the suitability, right, to the local context, which I think is critical. Sometimes I think that we do see technologies being utilized that aren't necessarily scalable or suitable to the, as I say, to the local context, and also maybe not technically viable to the local infrastructure, energy access, water access, things like that, and also maybe the local capacity to be able to operate and maintain those systems. I also think obviously critical is the community involvement to make sure that the solutions meet their needs and they have again, the capacity and willingness to accept the technology, but also to operate and maintain it. And then I think we talked about the long-term financing. I think Chandra touched on a point that's this ownership beyond donor financing, right? We often have, the bank, we come in 5, 6, 7 years, maybe maximum. And really, I think we're trying to more and more do a better job in ensuring that we have, I suppose, ownership and we are comfortable and know that in the long term that the government is going to, they've bought into sustaining the infrastructure in the longer term once the project closes. Because I think a lot of countries, I don't think it's just the Pacific, a large amount of the financing for this sector and specifically is coming from donor partners. So then it becomes maybe less of a priority for public expenditure and really trying to make the case through good data on why it's important, why having especially a budget line beyond the project for the long-term operation and maintenance. How do you get the right skill set so that and people across, getting like engineers, for example, from the water division into the healthcare sector, which may not predominantly have that type of skill set. How are they coordinating and working together? And I think, the political economy is a difficult one, but I think it's something, it's I personally feel that if you have very strong data, you make a very strong case, and you also are able to show success, then often, sorry, my something clicked on my computer. Often then you will see that the politics kind of follows, right? And this political willingness then, because they see that it's a good thing, voters speak. I know we're not a political organization, but I think that we know that politics plays a big role in what is prioritized, what governments are willing to spend on, and where they see the benefits. So I think I see in a lot of the countries that I've worked in, for example, in Tanzania, we made a really good case, maybe 7 years ago on just the money that was being lost in not investing and not being able to sustain wash and healthcare facilities. And now we see it being very much front and center, very much being prioritized by governments. Trying to bring in best practice from all different types of countries, not just within the region, but globally, and trying to learn and really, prioritizing it in terms of investment, but also in the long-term needs and operation and maintenance. And again, those things around like data and really understanding, being very responsive to the needs, so where there are breakdowns and really supporting that. Let me stop there, Guy. I don't know whether I answered your political economy question well enough, but
that's great. Thank you very much. And interestingly also about this transfer, and I'll come back, actually, I'll ask Sam to go first and then come back to Chandra to reflect on this. I think there's a big interest thing that goes back, back into the old world of aid effectiveness about, who drives what and what does that say. But to Chandra, before I come to you, Sam, just picking up a subset of some of the things that Juliet's talked about decision making. So Ruth talked there a lot about sustainability. But one of the things that Juliet's also flagged up is about resilience. And to what extent do you think policymakers and decision makers are really grasping with the concept of how you make systems resilient as well as being sustainable? Do you see that, and do you see any highlights about what we should do about that?
Yeah, that's a really interesting question. I mean, for me, this is a little bit the sort of interaction between universal and then a climate resilient, because at the moment there's a challenge getting to universal, right, by 2030, meaning 100% of healthcare facilities having at least basic wash. And climate resilience will often, it should be integrated, but often it involves a bit higher service levels, a bit of extra costs. So I think my perception would be that climate resilience And I think maybe we need to talk about health sector resilience more broadly, because there's also pandemic resilience, and COVID has helped pick that up, the agenda. But climate resilience, I think, is big on the is coming up on the agenda. My perception would be that there are understanding what it means. We've got this great guide, which is in mainstream climate considerations as well, but it's kind of guiding us towards technology decisions. But understanding exactly what climate resilient means in the local context can be quite challenging. Just to go to sort of like possible solutions to that. Just to mention again, the WashFit tool, amongst others. The latest version of that, 2021, has worked to mainstream climate resilience better in that guidance, as well as GEDSI, gender equity, social inclusion, disability inclusion. So there are tools out there. Yeah, I mean, then we could get into discussions about, as I was sort of alluding to, one of the challenges I think with designing for climate resilience, and don't forget, of course, we're talking in this region, including Pacific Island countries, is what some people refer to as the sort of cascade of uncertainty in terms of climate impacts as we go further into future time horizons. Which is not to say that the impacts of climate change are uncertain and the direction of travel is uncertain, but the local manifestations which need to be designed to strengthen resilience. There's some work to be done on that. So I think, Guy, to answer your question, my perception would be it's on the agenda. It's something coming to the question of partnerships and collaboration. People are increasingly working on. It's great to see it, as we would hope and expect, UTS mainstreaming it in the toolkit and the guidance would be critical, but more work to be done for sure.
Great, thanks, Sam. But yes, it's interesting you were saying about WashFit, because one of the early examples I saw was a picture of a nice big water tank raised on a metal platform, as an example of a resilient water supply, to which my response was provided you're not on a Pacific island in the middle of a typhoon track, in which case you've probably just created a water bomb that is very dangerous. Jitendra, picking up on the other bit that I think Ruth was talking about the financing and about some of the challenges that, because MDBs come in with capital, so capital is not the problem, and you've mentioned this before in the first answer. So how do we try to get to that point where people recognize that, the capital is one bit that might come external, but this is financing needs to be embedded internally? Do we need much more country ownership on these processes? How do we tackle that?
There could be multiple ways, and it is not that MDB is recognizing this issue recently. It has been there since long time, and there have been multiple efforts also done. Like, for example, not only financial, but also I was talking about operational maintenance, sustainability, and all. So multiple efforts were being done, and like one example I will give. You are creating an asset for, suppose, wastewater treatment, and then the expectation is that the technology provider will operate and maintain for certain years. Then for long-term sustainability, the important thing is that the local expertise, like if it is responsibility of municipality or health department, they should develop some capacity to run on their own. Then there will not be much requirement of a separate operation and maintenance. Huge maintenance fund will not be required. So that capacity building can be anticipated in advance, and identified staff could be attached with the technology provider to learn that when they are in the town, when they are with the healthcare facility, and they know how the knowledge transfer can be done. That could be one way. Second could be, and I was telling that there are multiple ways. We are not going to discuss everything, but second could be like, if I'm talking about freshwater requirement, then there are and these regions are having problems. Most of the regions are having problem with water. So maybe when we are treating the wastewater, Juliet was discussing about reuse. So in the new projects of healthcare facilities, we can think about dual piping. Certain water needs may be addressed by the reuse water. So those kind of things will help us in long-term sustainability, requiring less and less fund for that. And the last resort will be anyway to identify some fund for that in long term. So as I was telling, if we divert some of the fund towards this and see is as a whole picture, that by doing so we are preventing the pollution, preventing the disease thing in the atmosphere surrounding. That will help.
Yeah, no, I mean that's really great points. I mean, I think about the really thinking about the upstream determinants, and so actually, if you reduce the drivers of ill health, actually a lot of your problems more downstream start to reduce. And I think that's a really great point. And I think that the point about reuse is also really interesting. And I think, I mean, obviously there are challenges. Because you have a different type of waste with healthcare facilities, and we know more broadly people often are find it a bit difficult always to accept reuse, but I think increasingly we have to think about that. Jitendra, I wanted to follow on from that because I'm going to sort of flex the third question slightly, because I think you've actually answered quite a bit of this already about the partnerships between technology and donor agencies and partners, practitioners. But I suppose one of the things that might be interesting here is to specifically reflect on if we're trying to build these partnerships to accelerate progress, to reflect on two things. What is the role of the kind of the researcher community, by which I don't just mean academic researchers, I mean people in health systems who do research, operational research. So what is their role in strengthening, driving this, progress forward? And I think the second group, it'd be interesting to get your reflection on, because you've alluded a few times around people who are operating systems or providers. So how much, we talk a lot about donors and policymakers and communities from this side, from very much the public side. So how much do we need to look to the private sector and give more rein to the private sector to really find solutions in this space?
You picked a very right point, actually. In my
Researchers and private sector, yeah, the two particular groups I'm interested in. Sorry, please go ahead.
So you picked a very right point, actually. Private. This could have been one of my component in the last answer. Private sector participation is very much required for long-term supporting this kind of requirements. So first you asked about research organizations and researchers into this field. So to me, it seems like in the whole chain, if I look break into pieces, how this system will work. So first and foremost thing will be like identifying all the role players. We call it stakeholders. So they are like not only decision makers and people who are creating the taking the decisions and policy making, but also the people who are providing the technology, like private players and uh, sanitation workers who are going to own that in long run, directly or indirectly. And researchers as well play a very important role in bringing the innovation, bringing the state-of-the-art solutions. And also in this case, we see what we had the initial part of the presentation, which technology is suitable in which scenario, which context, those kind of information, which will be helpful in the longer run. So everyone has an important role. The requirement is that we identify all these stakeholders, look their individual interests. Maybe common objective is there, but their individual interests may be a little differing. So bringing them on a common platform, write the common objectives and make them aware of that. Then we can write the problem statement, what we are trying to achieve. What are our common targets we are going to achieve that? And I see that a kind of a clear communication as well as transparency is very much important to bring all the stakeholders together. So communication is a very important thing. Once the problem statement is already defined, then with the help of researchers, with the help of best practices around, we can try to find the solution. And while finding the solution, the role of decision makers and policy makers are very much important, regulators as well. Once we have reached that stage, then we should seek the feedback. feedback from the users, feedback from the staff who's going to work, sanitation workers. How do you consider these solutions? Do you have any suggestion into that? Once that is built, the most important part comes into picture is securing the budgets. So we might have already in mind who will approach donor, lender, or what kind of source, but now we know the estimate, what solution we are going to provide. So at that time, we we go back and secure the budget. And while securing the budget, the most important thing I consider is, again, communication, talking to each other, understanding who all are the players. Again, like World Bank is there, ADB is there in a particular town, or within department also, like I was earlier telling that health sector, are you having some budget to invest there? Am I having to some budget to invest there? So pooling of resources so that optimal solution is achieved. So that is a step when we created. And then comes the operation and maintenance. So I was telling that organizations like ADB have been working a lot in all the projects we try to inbuild the capacity building of the users, also behavioral change. So these things play a very important role once the assets are created, whether it will be water treatment or wastewater treatment or even resource optimization kind of thing. And that is the key for taking it forward in longer run. So if you ask me in short, then I can say that continuous communication, transparency, and taking everyone along. Whether whether you may find that okay, it is not less important or high important, but communicating with each other is a door to take them along, and then system could be sustainable. I hope
That's
I
great.
answered all the questions.
Yeah, no,
If
that's
not, please
great.
let
Thanks,
me.
Jitendra. That was very good and very clear, I think, and a very good comprehensive answer. Thank you very much indeed. I mean, I'm just a quick thought from you, Ruth. I'm just going to pick up a specific thing. I mean, there are specific communities that focus on operational research within healthcare or health systems. Do operational researchers have a role in this? Maybe not in the technology side, but actually, how do you effectively operate and maintain systems?
Sorry, I'm having an issue with my mute unmute. Yeah, no, thanks. I think researchers definitely play a role because, for example, it's uncommon, say for, I'm just thinking from the bank perspective, right? It's very uncommon unless it's very much earmarked that you're going to do like an impact evaluation or so, and also that's often quite rigid, in terms of within a bank operation. So having researchers come in, I find super helpful. They bring in different perspective. They have kind of an independent, objective role as to how a technology is being implemented. I think there's a role within technology, like research in terms of that, but also things just like the management models, right? So at the moment, this is something when you were saying about data, right? So the bank, we've been asked time and time again from clients, where are good examples of good, successful management models? So we started looking and we were like, there really isn't, right? And so then so we're hoping to do for what about like a study or, to try and find, because that's often what governments, that's part of the draw of the bank, right? We bring in global expertise and examples, and actually we're really struggling from that management model perspective of finding, long-term, good sustained systems in countries that we work in. And I think that's, maybe because the research community hasn't really focused on that area, or maybe it's just that we don't. I don't want to believe that we don't have them. It's just trying to find them, right? So finding parts of them. It might not be the complete system, but and so I think for sure. And then I just wanted to, sorry, just to come back. I think you made a question to Chandra on the private sector, because obviously we have IFC, which is part of the World Bank Group. So I think more and more we're being really pushed to think more innovatively about how we bring private sector in. And this here, I think it's quite interesting because and I may be proven wrong, but I don't think private sector will ever really want to come in just to focus on wash systems, right? They're really in return on investment and those things. So it's really thinking about how do we make sure it's a focal part of the health system development. The private sector is more inclined to come in and work with governments on. And I think they're, often again, it's around the hospital itself, the hospital environment, and just making sure that the wash systems are not forgotten about and are very front and center in terms of like disease prevention and all of these other things. and just, yeah, it should be there. So I think they were just the points I wanted to make on top. Thanks, Guy.
Great, and certainly I think the research into management systems is one of the really critical things, and I agree with you also on the private sector about having a broader role, but having just picking up on that, Sam, and despite me just saying you should have a broader role, just very quickly, I know UNICEF in other contexts and other bits of WASH has in the past supported local level private sector providers, and thinking about this region, do you see a role about how we can support, a local private sector to be able to service WASH, not everywhere, but maybe certain parts of the WASH system in healthcare facilities? Is that something that we could be investing more in?
Yeah, really good question, Guy, and really interesting thinking. And it was great to see, private sector there in the institutional system that was presented as part of this toolkit. And yeah, private sector means a lot of things, right? There's, but local private sector. I think there's a really interesting meeting here between the public sphere and the private sphere. I guess all of this is framed, these are public healthcare facilities, but actually just to mention that we need to ask our health colleagues, but I think a large part of healthcare provision in this region is coming through private, and out of pocket expenditure, which doesn't mean the public is not important. Arguably, it's increasingly important because it's the people with less out-of-pocket capacity who are going to public healthcare facilities. But anyway, public healthcare facilities with public financing streams and how they interact with private service providers who are, in this case, maybe installing facilities, maybe helping with the operation and maintenance, and how can that be stimulated? I think because of the public-private meeting point, it's a bit more challenging. Like, Guy, you were referring to some of the other work UNICEF has done, for example, in terms of sanitation, market shaping for sanitation-based market-based sanitation systems. There, the customer is the household they're buying, but here the customer is going to be the Ministry of Health or healthcare facility. So what are the areas, what are the touch points for potential engagement and strengthening? I think public procurement processes, that's an area which the public sector is engaging with private. And then one gets into this interesting area of potential market shaping, bringing together private service providers and matching them. I think that there is that actually this is in a way, because it's a bit of a niche, right? Whereas household sanitation, you've got big markets, whereas this we're talking about, I don't know, in some Pacific countries, less than 100, in bigger countries, it might be thousands of public healthcare facilities, but it's not such a big market. So I think it needs to be approached quite carefully. And then we're still in the O&M question and how to engage, which there you'd need even more sophisticated public contracts to engage private sectors in ongoing service provision. Just a quick reflection from the UNICEF side. We're probably working on this more in relation to healthcare waste management. There's a work stream going on at the moment about green waste treatment and disposal technologies, and then solar electrification of healthcare facilities, which connects to the energy piece, connects to water to a certain extent, because water systems need electrification. And there probably is more direct engagement with private sector service providers and an interesting meeting in some cases between international service providers and local. But yeah, interesting question, Guy. Definitely something. I'd also say it's very country specific, because the frameworks for public-private partnerships vary enormously between countries. If I may, Guy, just quickly on the role of the research community. I think there's a really important role for, and this is, this talk is part of it, helping research to help make informed decision making, and there I would include on the costing, and that's a big gap, and it's the second step of the 8 steps of the UNICEF WHO 8 practical steps for wash and healthcare facility, costed roadmap. But from reporting countries in our region, it's also an area where there's a big gap. And there, research work, which is happening in some countries and some parts of the world, on what does this cost, locally, and then putting that together and what does it cost to meet universal, and then connecting up these different dots of talking to ministries of finance and advocating for that. I think that's a big role potentially for research community.
Great, thank you, Sam, and thank you all of you. I'm going to draw us to a close now. I mean, we were potentially going to discuss around dissemination of the findings, but actually I think the conversation that we've had this morning, I think is actually being more useful, and I think in many ways flags up and highlights some of the key things that we would want to think about as we use these guidance. And I think the kind of considerations that have to be put in place when we work with governments, when we work with the private sector, when we think about approaches. So I'd just like to thank all 3 of you very much for your time. It's been great. Thank you very much for the insights that you've all given us today. I hope everybody has found that really helpful and informative. So a quick virtual round of applause for our 3 brilliant panelists. Anybody else's cameras on, so you can see me and Jin Won, but not necessarily anybody else. And with that, I'm going to hand back to Jin Won. So thank you very much, as I say, and Jin Won, back to you.
Thank you, Guy Howard, for your time management and make it this panel discussion more fruitful, and all the panelists today to participate. And I really like the discussion and the very useful information we should consider, or they will tackle all the issues we need to consider how to implement this guideline, and also how to enhance the water supply and sanitation in this region, I think. So really appreciate all of you. And the next week is March 22nd is World Water Day, and the theme is water for fish, and the water scarcity and the polluted water, and the lack of water is linked to the tension. And I think we appreciate all of you. We can contribute in a way for the world peace by this kind of water supply and sanitation work in this region and in the whole of the world, I think. And with the conversation today, and also the publication is coming soon, so we will disseminate when it's ready, and we will inform you about this information again. And I really appreciate all of you, the Professor Guy Howard for moderating today, and the panel, Dr. Ruth from World Bank, and also Jitendra in the ADB, and Sam from UNICEF, and the speaker, the UTS, the Juliet, and the Benny. I really appreciate all the participants today till this time to still listening, and thank you so much. Thank you so much. And the WHO Pacific Center for Environmental Health in the West Pacific region, we hope the publication contribute to the peace, and also will inform you, and you can contact me by email if you have any suggestion for any other issues related to water. We highly appreciate. Thank you for your participation and kind attention, and have a wonderful day. Thank you. Thank you so much.